Live Right Now. Tips and insights on living a healthy lifestyle brought to you by the health experts at Carthage Area Hospital, so you can live right now.
I'm Phyllis Farrell, nurse practitioner. I'm here to talk to you a few minutes about the importance of cervical cancer screening. The incidence in 2010 of cervical cancer new cases in the United States was 12,200 new cases. There were 4,210 deaths in 2010 from this cancer, which sounds like a fairly small cancer, but in fact it's a very treatable, screenable. We can find this cancer in its very early stages, so it's very preventable cancer. Prevention is determined by, not by symptoms, but by regular Pap screening. Pap tests are begun typically at the age of 21, no later than 21, or earlier depending on an individual female condition. They're continued throughout the 20s and the 30s at regular intervals, and then sometimes later on after menopause or after age 60, then they may be individualized depending on the age of the female. I want you to take a look here at the test itself and how it's done. There are a couple little brushes here. One's called a broom, the other's called a brush. And this little model shows you what the cervix is. It's this bottom portion of the uterus. There's a very little opening in there, and that little opening has a little smiley lip. So if a sample was going to be taken of the cervix, there would be used a speculum. Lots of people call these different things, but that's the professional term is a speculum. And there's a tube here called the vagina. This goes in, opens gently. A little brush, put in here, twirled around, or a broom, put in here, twirled around, and then put in a little bottle like this and sent to a laboratory. And I will leave you with a couple thoughts as I'm finishing up and remind you that half of all of the cancers that are found in women who've never had a Pap test, ever. So, if you know someone who's never had a Pap test, remember, it's a good thing to do, it's an important thing to do, and it can save a life.
Live Right Now. Tips and insights on living a healthy lifestyle brought to you by the health experts at Carthage Area Hospital, so you can live right now.